Now we'll come to the topic proper. As before starting my talk, even he had given me a challenge that already you've been exposed to Atlas schemes. So right now I'm at a compromise situation, so that I should try to overcome their efforts. So I believe after I finish my lecture, I'll be scoring good marks. Let's hope so. I don't know whether I should thank you or
At this moment you can be at the balance zone, don't worry about it.
Okay, so we'll start off. My topic for today is something all of you know. It is not a new thing. No one in this group has not experienced a back pain in their life. Coming to the incidents, why I chose this topic is, it is a disability is the second common cold which is producing loss of work time. You know common cold, how common it is, and it's second most to it. So what a formidable position for a disease assets to have. And 80% of the adults throughout their lifetime would have suffered back pain at one point or the other. And globally it is mentioned as it has got the highest prevalence producing loss of work time during their most economic age group, like 45 to 60-year-old. That is the most powerful workforce of a nation. So it has got a lot of economic aspect as well, and this back pain. So before going to see, our interest today will be like how to prevent back pain or how to have a healthy back. So before going to that, I'll just only divide like how we see a patient when a back pain patient comes to us. Generally, we divide those into bony cause and muscular cause, like pain arising on the bone, which can be spondylosis, canal stenosis, IVDP. So I'm only going to any of this because he has mentioned that we don't want a classroom session here. So once a patient comes to me, I usually check a general history, like how the pain started, whether he had a history of lifting heavy weight, whether he had a dull aching pain just throughout the day. And there are several forms of history points which will help us in classifying the nature of the back pain. So my point of view is, whether you are going to a doctor, just clarify them how the back pain started, how was the onset of the pain, any specific action just triggered it, and any specific movements of the body which will help in relieving back pain also. That also helps in include. Progression of the pain as such, like most common cause of back pain is generally in IVDP, which is everybody knows it as a disc prolapse. In that case, the back pain starts in the back and reduces down to the leg. And sometimes in another cause like spinal canal stenosis. This canal stenosis, just briefly, this back vertebra has got a small space through which the nerves go to the leg. So it is a very small, tiny space. So if there's any pressure or any reduction in the space, it will press on the nerve and produce back pain. In such situations, when the patient stoops down forward, the canal widens. In that case, the pain reduces. So this is how we differentiate between a back pain caused by an IVDP or by causes by canal stenosis. And clinical examination, as soon as patient comes to your OPD or comes to your room, or generally as a layman, if you see a patient with back pain, you'll be able to identify that they'll have a small list towards one side. That is a body nature to protect your muscles or nerves from further damage. So if there is a damage to the nerves which is producing pressure on the nerves, your body as it will tilt towards the other side. So it is trying to provide more space for that injured nerve. So just such an attitude, if you see in one of your colleagues, one of your fellow workers, then he has to meet a doctor. And very common sensation which most patients is the pins and needle sensation, which you all know. Like when you sit on a cold floor for a long time, your legs will feel heavy, it will have a heavy feeling, pins and needle. That's a typical sensation which a patient is going to have in a late stage of disc prolapse. And every one of us know that it is such an irritating feeling. So imagine a patient who is having to carry that sensation throughout his life. So this is one of the sensations which most of the patients tell us when they come to my room. And there are some form of test which we conduct in a doctor's room. One of the classical tests is an SLR, which is called a straight leg raising test, where they make the patient lie on a cot and they lift the leg up. So in that case, what we are aiming to do is we are stretching the nerve. So if there's a nerve is damaged, a nerve is diseased, if nerve is affected, the moment you are stretching the nerve, again it will have the same pain that the patient is feeling. So this is one test which helps us to differentiate between a back pain coming from a disc, from a back, from a nerve, or from anything like urinary stone, gynecological issues, muscular cause, whatever. Maybe this is one of the tests. So the reason why I am telling you this, one of the patients told me that he has got a back pain. He came to my cabin. So I asked him to lie on the table and I started lifting up his leg. So he just casually asked me, see, I am having a back pain, why are you trying to lift my leg up? So I just want you to clear up this. This is why we are doing that. So he was telling me, why don't you examine my back? Why you are just lifting my leg and see? So this is one of the things. And routinely we do such an investigation like an X-ray is the most common investigation. But having said that, if a patient is having back pain, the gold standard of investigation is the MRI, because if you are having if you're given a choice to do only one investigation that will clear what the cause of back pain, it is an MRI. And that you have a 1.5 Tesla MRI, which is clearly differentiate between a urinary stone, gynecological issue, nerve disc prolapse, nerve or whatever. Before, or example, in a medical college or an academic setup, then we can have an array of tests. Like initially we can go for an X-ray, then go for an ultrasound, then rule out all those things, then go for an MRI. But in a private setup, or in where a patient has to pay cash for that, then we need to go have a gold standard test. That is one thing, is an MRI scan. And these are some of the tests, some of the findings which we get in an X-ray, like a spondylolisthesis, which is actually, I thought is an interesting thing. This is a backbone, where one bone can slip over the other one. That can produce this one. And it will irritate on the nerve, which will produce a back pain. And this is how it looks like. This is the normal curve, and this is the separated bone. So that will be there maybe after a fall, or after lifting heavy things, or maybe from the life birth onwards. And this is something which is not common in this part of the world. We most commonly see in India, and that part where tuberculosis or infection of the spine. So that can all produce with back pain. These are some of the findings we get from an X-ray. And this is a typical MRI scan finding, where the disc has this is the bone, and this green is the white thing, this is the disc. So the disc has bulged out, and this white thing is coming down is the nerve. So this is how it bulges and presses on the nerve. And this is a very, very magnified image. So this may be around 10 mm space only. So any minor bulge of the disc can produce so much symptoms and so much pain that when a patient comes with an MRI finding like this, you should understand that he must be having severe pain. Treatment, just to brush up, there is several before taking the patient on the operating table, there are several treatments like ice and heat, bed rest, analgesics, muscle relaxants, some form of injections will be given to the disc. Like if the patient is not improving with the bed rest, and if you are given a rest for back pain, it means bed rest. There is no other form of rest, it means bed rest. That should be clear in your mind, because so many patients come to me, they take rest and they roam around several parts of Muscat, they come back after 2 days, children, and pain has not improved. That is not a form of rest. Rest has to be bed rest. And several medicines like analgesics. In that point, I would like to stress that some of the patients, here the major problem is, if you give a medicine, most of them are not worried about the effects of the medicine, they're worried about the side effects of the medicine. They don't mind smoking 20 cigarettes per day, they don't mind drinking occasionally, they don't mind eating mutton, they don't mind eating chicken. But if you give them an NSAID or a painkiller, suddenly they'll ask, no, this is going to affect my kidney or liver, I'm not going to take this. So that mentality has to be avoided. So we focus mainly on the effects of the medicine. There will be 90 effects of the medicine and 10 side effects. There will be more focusing on the side effects. That is not the proper way to do it. If a patient is having a disease, he has to take a medicine, because there is something called as a pain cycle in your body. If some area of the body is injured, it is going to release some neurotransmitters that is producing pain. So that will again further damage the body. So this is a cycle, it's called a pain cycle. So unless we give a medicine and break this pain cycle, whatever magic you are going to do, this is not going to affect. So that is why the reason why most of the doctors give painkillers. And some of the patients take it for 2 days, once the pain is, they stop it. So that is also not the proper way. There is some prescribed course for a medicine that has to be taken properly. And after this medicines, bed rest, if still not improving, in most of the disc problems, we give something called an epidural steroid injection. That is a specific injection which we give into the disc part that will help to reduce the disc bulge. These are all like non-surgical methods. And physiotherapy that plays a big role in back pain treatment. We have a dedicated physiotherapist, one male and one female. They are doing good work. They do regularly physiotherapy, especially my post-op patients, otherwise back pain patients. So physiotherapy also is a form of conservative treatment. And further, then we will do the surgical, that I don't think I'll be discussing here. And physiotherapy also includes like ultrasound, there are some form of modalities, some back exercise, in some form of disease, because it is determined by patient to patient. Some patients may need some form of flexion exercises, some may need extension exercises. That has been determined based on the MRI finding, based on the patient's symptoms. And there is something which we call as red flag signs. This red flag signs simply means that this should not be taken granted for. We should take immediate action. Something like back pain is not common in children. So if a child is persistently complaining of back pain, that has to be taken care of. It must be investigated. Why most common reason which we see in this part of the country is a vitamin deficiency that has to be ruled out, and a back pain, sudden onset back pain more than 50 years old. That when general back pain will be there, but if there is a sudden increase in back pain, especially more than 50 years old, you should always rule out secondary. Secondary means secondary from tumors or metastasis, anything that has to be ruled out. Unexpected weight loss, maybe an infection or some form of cancer in the body. Previous serious infection or generalized weakness. Sudden recent onset of weakness. And loss of sensation suddenly. That means generally there will be small, gradually, but if there is a sudden loss of sensation, that means the spinal cord or the nerve is getting damaged. Or something like where the patient cannot hold his bladder or bowel, urinary incontinence, that all are like red flag signs. So this will be generally like how we look into a patient when they come to our cabin. So some of the questions which I faced when over the last 6 years which I came here, where one thing is most of the patients ask me, doctor, I have an office job, like sitting, I need to just like your HR explained that you need to sit for 8 to 9 hours. So how should I sit? So by ending on this topic, I think I should be able to explain like how to sit properly and how long to sit, what to take care while you're sitting, and which is the best position for sleeping. That is one question which we commonly face. And there is common thinking that sleeping on a mattress is going to worsen back pain. Whether I should sit on the, sleep on the floor, sleep on the wooden thing. That are all some of the myths that has been roaming around this back pain issues. And a lot of patients come to me with a heavy job like lifting heavy weights. So we cannot tell them not to lift heavy weight because that's going to affect their salary. So how to lift a heavy weight or how to go about their job. And some of them, they come with that lumbar belt. I think most of you are aware, like that belt which you give for the back pain. So whether is it useful? And the most important, the $1 million question is, if my back pain or my disc is it completely curable or not? So I'll be, through my presentation, I'll be dealing with most of these things. In between, if you have any sort of doubt, anything, just ask me in between also, it's fine. So this is the one thing which I had commented earlier. If a doctor has advised you to take rest, it is bed rest. It is not these forms of rest. It is not going to help you in any form. It is just going to worsen your back pain. And one thing which I use the best position to sleep. If you are having a normal back, if there is no back pain at any point, sleeping in any position is not going to affect. But if you are having a back pain or if you are a patient with the back pain, the best position to sleep is on sleep on your sides. Sleep on your sides and preferably try to keep a pillow between your knees and gently bend your knees. So gently bending your knees will help to relax the back nerves, back muscles, and will also help to prevent the further pressure on the disc. Or if you are in a position not to sleep on your sides, for example, some of the patients who had undergone surgery, any hip replacement or anything, they are not able to sleep on the side. You can sleep on your back itself, but always try to keep a pillow beneath your knees, and so the knees will be slightly bent. That will help to relax the nerves. So this is how you should or you have to try to sleep when you are having a back pain. This is one of the interesting slides which I always present in all my presentations. These numbers, they show your intradisc pressure measurements. So these are various positions. See, imagine you are lying down, your intradisc or intra-spine pressure is only 25. So just imagine when you are sitting, it just shoots up to 140. So this is how your back is getting affected when you are lying down position to the sitting position. And in sitting position, you just stoop down to pick a piece of paper, it is raising up to 195. And in that position, if you are lifting up a heavy weight, maybe a small laptop, it may not be a heavy weight, maybe a laptop bag, it goes up to 275. So this is how, and this is what like sitting. How to sit? When you are sitting, just concentrate. When you are sitting on a chair, there should not be a gap between your back and the back portion of the chair. So at least when I am talking this, you should sit straight. Your earlobe, your shoulder, your pelvis, that should be in the same way. I know very well it's very difficult to sit always like that. Only robots can sit like that. But still, try to maintain that posture. And when you are sitting, just try to prevent any gap between your back and the chair. And there's something, this chair has got a lumbar support. This curve is what we call as a lumbar support chair. So this supports your back. So that is actually good for your back. If you are having such a chair, well and good, it will support your back and always sit straight. And when you are driving for a long time, always try to keep this It's called a backrest, which will, some of the cars they have that inflatable backrest which comes. Otherwise, you have to keep a small pillow which will help to prevent that back pain. And always try to keep your shoulder and pelvis. Pelvis is this portion in a same line. Okay, that will improve your look also, improve from the back pain. And this right thing is the wrong way of sitting. Like if you are working on a laptop, if you are lifting it, that will be coming to driving. But nowadays, what I see is if you go to a taxi, they will be having good chair, but they will be driving like this. That is the wrong way. You have a neck pain, back pain. Always try to be comfortable, and always in working, you should always maintain a working height. That is a eye level and the shoulder. That is something called as a working height, which will help to reduce the strain on the neck and the back. So coming to the main part of the topic is tips for a healthy back. Always stretch or exercise before any strenuous physical activity. So if most of us go for like playing on Fridays, so if you are having like you are not playing for a long time, always stretch before going, and don't slouch by standing or sitting. That is not good for your back and for your appearance also. And at home, as I told, that always make sure you have a comfortable height for working. Even if it is for a small work, maybe you think about 5 minutes work, I'll just finish up and go. But this 5 minutes will get accumulated, so it's not good. So always try to maintain a comfortable height. And this is what I told earlier, when you are standing and when you are sitting, always maintain that your earlobe, shoulder and the pelvis there should be at a straight line, and that will help to maintain a good back muscle posture. And sleeping on your sides, as I told earlier, and if you are not happy sleeping on sides, always sleep on your back with a pillow under the knee. And those who are involved in lifting heavy weights, don't try to impress others by lifting heavy weights by yourself. Always there is a technical way by which you should bend your knees, go down, tuck up your stomach, then only lift. You should not lift like this. That is going to injure your back. And even small weight, as I told, laptop back, you may be coming out of your table, your laptop may be on the other side. Just try to do like this, that is going to sprain your back. Even 2 kg weight, you won't believe that, because we are not designed to do such activities. So you should go around, get that weight, then come back. You should not stretch and get any small weight from the other side of the table. And always maintain healthy nutrition. Always check on your BMI. BMI, as I always, it is a relation between height and the weight, and also central obesity. If your weight on the middle portion of the body is good, then your back muscles will be less toned and will have a very bad back pain when you are having to go for heavy work or something. If you are straining too much, then you are at a higher risk for getting a back pain. And always a good intake of food rich with vitamins, minerals always helps. And if your habit of smoking, you should quit smoke. Only because smoking will reduce the blood flow to that affected part. So whatever treatment you are taking, or whatever the body is trying to cure the back, whatever the blood, since the blood flow is less, that healing process will take more time. So more the time, more the injury will happen. So quit smoking for a healthy back.